Good morning, this is Dr. Deepa from SRM Dental College, Ramapuram, Department of General Pathology. Today's topic is neoplasia. Neoplasia, which means an uncontrolled abnormal growth of cells or tissues in the body. And this abnormal growth itself is called a neoplasm or a tumor. It can be malignant or benign. So benign means non-cancerous. They do not spread or invade the deeper tissue or other parts of the body. Malignant tumors do spread and they invert the neighboring tissue, and the term malignant means cancerous. So cancer, we all know it is a very serious illness which can lead to death if not treated in time. And if treated also, the prognosis is quite poor depending upon the stage of cancer. So neoplasia means new abnormal proliferation or new abnormal development. We can split neo as new and plasia as development. But this will not give us a precise definition. New growth alone does not give us a complete definition because there are so many new growths which cannot be considered neoplasia, like proliferation or growth which is taking place in embryogenesis, repair and regeneration. These come under normal development, whereas neoplasia is an abnormal development. So the exact definition of neoplasia is, it is the result of an abnormal, excessive, which means it is more in number than required, uncoordinated, that is when compared to the adjacent normal tissue which grows with a definite pattern. Cancer cells do not have that definite pattern, they are uncoordinated. Autonomous, that is it responds, reacts and develops independently as a whole when compared to the adjacent cells. And next, coming to purposeless. Purposeless is nothing but it does not have a definite purpose when compared to the normal cells. It just multiplies without any need, and more than all, the most important factor here is the cessation of the stimuli will never stop proliferation of the tumor cells. As you can see in this diagram, there are two different types of cell. One is the normal cell, which is arranged equally, uniformly, and there are a specific number of layers. Whereas the one which is in blue, you can see how haphazard it is. It is uneven, it is of different size. The nucleus is so big and it is hyperchromatic. It is far away from the basement membrane and so many other different irregularities. So this is the cancerous cell, which is very different from that of the normal cell. So all these changes have to take place to become cancerous. So this we will be discussing in detail in the coming up sessions. These are some of the list of risk factors. In these patients, the risk factor of developing cancer is more. First and foremost is aging. In patients, as they age, the amount of immune system reduces. Along with that, the period of exposure to carcinogens also increases, leading to increased risk of developing cancer. Tobacco is a leading cause of cancer and death from cancer because the tobacco products which they are using have many chemicals that damage DNA. Exposure to sun as UV rays. So this UV radiation from the sun can damage the DNA. So this damaged DNA builds up over a period of time and they start growing out of control, which can lead to skin cancers. Exposure to very high level of radiation, such as being close to some atomic blast, can cause acute effects such as skin burns, radiation syndrome, and many other cardiovascular diseases, and also they can develop cancer. because the cells are damaged. So next, coming to the virus. So there are so many viruses which bring about cancer, which bring about changes in cells leading to cancer, which we'll be studying in the upcoming sessions. Hormone levels. Certain hormones, like one example estrogen, play a very important role in development of cancer. Actually, estrogen plays a vital role in sexual development and reproductive health, but this is also a carcinogen, which means it has the potential to cause cancer. Next, coming to family history. So cancer is an inherited disease. Okay, why? Because the DNA is carried on to the offsprings, and any mutation in it is reflected even in the offsprings. Alcohol. Alcohol is a known carcinogen. That means that alcohol causes cancer. There's a strong evidence that drinking alcohol increases the cancer of female breast, liver, mouth, throat, esophagus, and even bowel. Next is poor diet. By poor diet, what we mean is the habit of eating, the lifestyle. So the diet which is having more of carcinogens, like more of less of antioxidants and more of free radicals, have increased chances of developing cancer. Lack of physical activity. Sedentary lifestyle is another very important factor which has to be changed so as to stop cancer. So this alone, all these alone and in combination are the risk factor for cancer. Overweight. Being overweight, this again comes in sedentary lifestyle and poor diet. So all these are the risk factor for cancer. In neoplasia, that is study of cancer on, we will come across various terminologies which you should be well versed with. So study of neoplasm is called oncology, onco which means tumor, and logos is scientific study. Neoplasm can be of two types. One is malignant, the other is benign. So as you can see here, neoplasm is divided into benign and malignant. Further, malignant is further divided into carcinoma and sarcoma. Carcinoma, which is from epithelial origin, and sarcoma is mesenchymal origin. This is a list of benign tumors. They end with the suffix -oma. Example: fibroma, which usually develops from tendons and fascia of deep soft tissue. Chondroma, which is a rare tumor made up of cartilage, and it forms on or in bones of soft tissue. It can be seen either in bone or in soft tissue. Osteoma is benign overgrowth of bone, mainly seen in the skull. Lipoma is fatty lump, mostly situated between skin and underlying muscle layer. Adenoma is benign tumor of glandular tissue. Cyst adenoma, it is a rare cystic tumor which is seen in liver. Papillary cyst adenoma is also a rare benign salivary gland tumor. This is well circumscribed and it contains cystic cavities. All tumors ending with oma does not mean they are benign. There are some exceptions. One among them is melanoma, which is the carcinoma of the melanocytes. It's a tumor of the melanin forming cells. Next is the lymphoma. Lymphoma is a cancer of lymphatic system. Lymphoma can affect all those areas as well as other organs throughout the body where it supplies. Teratomas are made up of mixture of various tissue types arising from the three germ layers, that is ectoderm, mesoderm and endoderm. This usually happens when there is complications during the cell differentiation process. Blastomas are thought to be due to genetic error during fetal development. They are also referred to as embryonal malignancies. So when cells fail to develop into their final type before or after birth, this type of tumors develop in the body. These are the common sites where blastomas occur. Hamartoma is a benign growth made up of an abnormal mixture of cells that is situated in an organ. There will be excess disorganized cells in the normal location. Choriostoma is a development tumor-like growth of normal tissue in an abnormal location. So usually it is seen in oral choriostoma, that is composed of bone, cartilage or both. As we come to an end of today's session, the next topic will be on the difference between benign and malignant tumors. Thank you.